Welcome to another deep dive. Today we're going to be looking at something pretty fascinating. You know, this research article from Oxford Open Digital Health,
Yeah.
the one about the impact of ALMANACH in Somalia, it really caught my eye.
Yeah, it's pretty incredible work.
Yeah, it's so interesting to think about how technology can be used to address these really complex healthcare challenges. So
Absolutely.
we're talking about a region with one of the highest child mortality rates in the world,
Right.
and healthcare is incredibly fragmented. Resources are scarce,
It's a challenging environment, to say the
for
least.
sure. And that's where Almanach comes in. Can you give us a quick overview of what this is for our listeners who may not be familiar?
Sure. So ALMANACH is basically a tablet-based clinical decision support system. It's designed to help healthcare workers in Somalia provide better care to children under 5.
Okay.
And it's based on the WHO's guidelines for integrated management of childhood illness. So it's really rooted in the best available evidence.
That's amazing, especially considering that they're often working without internet access.
Right, exactly. It has to be able to function offline.
Wow. Just from skimming the article, what are your initial thoughts about this?
I mean, the potential impact is huge when you think about it. Consistent access to the latest medical guidelines, even in remote areas, that could be a game changer.
Absolutely.
Hmm?
Okay, so let's dive into the specifics of the situation in Somalia. I mean, the article paints a pretty stark picture of the challenges they're facing, right?
Yeah, it does. I mean, you're talking about a country that's been dealing with protracted conflict for decades.
Right.
Severe droughts have become more and more frequent, and the healthcare system is stretched to its limits. There's a critical shortage of trained healthcare workers, too.
It's heartbreaking. The article mentions that 1 in 8 Somali children dies before their 5th birthday.
Yeah, that's one of the highest child mortality rates in the world.
And it's mostly from preventable causes, right?
Exactly.
Mm.
Things like pneumonia, diarrhea, malnutrition.
Those are the types of conditions that Almanac is designed to address.
That's the hope.
I mean, if you can even make a dent in those numbers,
The impact would be incredible.
it's almost like this technology could help rewrite the future for these kids.
I agree.
So how does Almanac actually work? I mean, it sounds pretty complex.
Yeah, it is sophisticated, but the idea is actually pretty simple. It's basically a digital guide for healthcare workers. It walks them through the process of assessing a child,
Yeah.
helping them make an accurate diagnosis, and then providing treatment recommendations based on those WHO guidelines we mentioned.
So it's like having a virtual expert by their side.
Yeah, exactly. And it's tailored to the context, too, so it takes into account things like the availability of medications and local practices.
That's so smart. And it can work offline, right? That's crucial in a place where internet access can be spotty.
Yeah, absolutely. That's one of the key features. And it's also available in Somali, so there are no language barriers.
Wow, they really thought of everything.
Yeah.
What about this whole data collection aspect? The article mentioned that they're tracking things like consultation times and types of diagnoses made.
Yeah, that's really important for any kind of intervention.
Yeah.
They need to be able to understand how it's being used and what kind of impact it's having.
Right. It's like they're building in a way to constantly learn and improve.
Exactly. And the data they collect can help inform future iterations of the system.
That makes sense. So they rolled this out in 7 different health facilities across South-Central Somalia.
Right.
And what did they find? Did Almanac actually make a difference?
The results are pretty compelling. Let's start with antibiotic stewardship, because that's a global concern right now.
Yeah, for sure. Antibiotic resistance is a huge issue.
Exactly. And Almanac seems to have had a dramatic effect on that.
Okay, I'm really curious to hear about this.
So the article says that after the system was in place, kids were nearly 4 times less likely to receive antibiotics.
Wow. 4 times less likely.
Yeah.
That's huge.
Yeah.
What does that mean for those kids? And for Somalia as a whole?
Well, for the individual child, it means they're less likely to experience the negative side effects of unnecessary antibiotics. Things like allergic reactions or disruption of their gut microbiome. And on a broader scale, it means they're less likely to contribute to the growing problem of antibiotic resistance.
It's all connected.
It is. You know, when bacteria become resistant to antibiotics, it affects everyone. This isn't just a Somalia issue, it's a global one.
That's a great point. So Almanac is playing a role in a much bigger fight.
Absolutely.
And it sounds like it's making a real difference. What else did the researchers discover?
It is remarkable, isn't it?
Yeah, it's amazing to think about the ripple effects of this technology. You know, last time we were talking about how Almanac is helping to tackle the issue of antibiotic resistance in Somalia.
And doing a remarkably good job, it seems. Reducing unnecessary antibiotic prescriptions by nearly 4 times is a significant achievement.
Absolutely. But the article goes deeper than that. It
Yeah.
highlights how Almanac actually helped healthcare workers identify those cases where antibiotics were truly needed.
Right, and this nuance is important. The goal isn't to eliminate antibiotic use altogether,
Nope.
but to ensure they're used responsibly and effectively.
Yeah.
And ALMANACH seems to be guiding those decisions in a really positive way.
It's fascinating how this technology is essentially bridging the knowledge gap,
Right.
ensuring that these healthcare workers have the latest information at their fingertips, even when they're miles from the nearest hospital or specialist.
Precisely. And speaking of bridging gaps, the article also highlights ALMANACH's impact on prevention and screening.
Oh, yeah. Those numbers were pretty impressive.
Weren't they?
I was amazed to see that vaccination status checks jumped to 98% vitamin A needs, need checks increased fivefold, and anemia assessments went from a dismal 7% to an incredible 97.3%.
It's a testament to how ALMANACH can prompt those essential preventative care measures. It's like a built-in checklist, ensuring nothing gets missed.
And in a context where malnutrition and vaccine-preventable diseases are so prevalent, those checkups can be life-saving.
Absolutely. Early detection is key, and ALMANACH is clearly playing a vital role in that. But there's another area where it seems to be making a real difference: communication.
You're talking about the increase in caregivers receiving information about their child's diagnosis and guidance on follow-up care, right?
Exactly. The article highlights a pretty dramatic increase in those areas.
It makes sense.
Think about it. Clear communication builds trust. And when caregivers trust the healthcare provider, they're more likely to follow treatment plans, bring their children back for follow-up appointments, and feel empowered to take an active role in their child's health.
That makes a lot of sense. It's almost like ALMANACH is fostering a sense of partnership between healthcare providers and the community. But how did the healthcare workers themselves feel about using this system? Did the researchers collect any feedback from them?
They did, and the response was overwhelmingly positive. They reported feeling more confident and competent in their ability to assess, diagnose, and treat children.
That's not surprising.
Yeah.
It's like having a safety net, knowing you have access to the latest medical knowledge, even in the most challenging circumstances.
Did they mention anything specific about ALMANACH that they found helpful? Yeah, they particularly appreciated the reminders and prompts that helped them stay on track with best practices. They felt it took some of the guesswork out of providing care, especially in those more complex cases.
Right, so it's not just about having the knowledge. It's about having it presented in a way that's easy to understand and apply in real-world situations. Did they talk about the impact on their interactions with caregivers?
They did. Many healthcare workers felt that ALMANACH improved their communication with caregivers. It helped them explain diagnoses more clearly, answer questions more effectively, and ultimately build stronger relationships with the families they were serving.
That human connection is so important, especially in a setting where trust might be fragile due to conflict or instability. The article even included a quote from one of the healthcare workers that really struck me.
Oh, yeah.
They said, "ALMANACH provided a local solution to the most common conditions. Lemon, honey, and tea were available ever since I was young, but we did not know their effectiveness. With minor coughs, we noted that antibiotics are not needed, and we are teaching our communities the use of local remedies."
That's a beautiful example of how ALMANACH can bridge the gap between modern medicine and traditional practices.
Yeah.
It's about empowering healthcare workers to make the best decisions for their patients, using all the tools at their disposal.
It seems like they've created a system that's both technologically advanced and culturally sensitive.
Mm.
But what about the caregivers? How did they perceive ALMANACH?
Well, the researchers conducted exit interviews with caregivers to gather their perspectives,
Okay.
and the response was overwhelmingly positive. They reported feeling more confident in the care their children were receiving.
Yeah, I can see why if I saw a healthcare worker using a sophisticated system like ALMANACH, I'd probably feel more reassured too. It signals a level of expertise and care.
Did they say anything about the communication aspects we were talking about earlier?
They did. Many caregivers appreciated the clearer explanations and the feeling that they were more involved in the decision-making process.
Right.
They felt their concerns were being heard and addressed. That's so powerful. It turns the whole medical encounter into a collaborative experience rather than a one-sided interaction.
Exactly. And it's worth noting that caregivers were less likely to demand antibiotics after ALMANACH was used.
Oh, interesting.
This suggests that the system is helping to shift expectations and promote more judicious approach to antibiotic use, which is beneficial for everyone in the long run.
So it seems like ALMANACH is having a positive impact on multiple levels. It's improving the quality of care, empowering healthcare workers, and fostering trust within the community. But I'm curious, what are the broader implications of this research? Could a system like this work in other parts of the world?
That's the big question, isn't it? And the researchers do believe that Almanac could serve as a model for developing similar digital health interventions in other resource-limited settings.
Okay.
They emphasize the importance of adapting the system to the specific needs and context of each location.
Right.
But the core principles could be applied in a variety of environments.
It's exciting to think about the potential, isn't it? But I imagine there are also some significant challenges to consider. Implementing something like this on a larger scale can't be easy.
Of course. The article acknowledges that rolling out a digital health intervention like Almanac H requires careful planning and a lot of groundwork. Things like training healthcare workers, ensuring reliable access to technology and support, and addressing any cultural or logistical barriers that might arise.
And then there's the issue of sustainability.
Right.
These types of interventions can be expensive, and you need to make sure there's a plan for long-term funding and support.
Absolutely. Sustainability is key. You don't want to create a system that's dependent on external resources or expertise. The goal is to empower communities to take ownership of their own health and well-being.
It's a reminder that technology is just a tool. It can facilitate change, but it can't create it on its own. It's about people, partnerships, and a shared commitment to a healthier future.
Couldn't have said it better myself. We've covered a lot of ground in this deep dive, but there's still so much more to explore.
We'll be back with part 3 to wrap up our discussion and consider the future of digital health interventions. Welcome back to our deep dive into Almanac. It's been quite a journey, hasn't it?
It really has, from those stark realities in Somalia to these incredible results.
It's amazing to think about the potential of digital health interventions like this.
Yeah, it's definitely given me a lot to think about.
So we've seen how Almanac is tackling antibiotic resistance, improving preventative care, and really strengthening that communication between healthcare providers and caregivers.
Right, and I think it's important to remember that technology is a tool.
Yeah.
It's not a magic bullet.
No.
It can amplify our efforts, but it can't replace that human element of healthcare.
Absolutely. Compassion, empathy, cultural understanding, those are always going to be essential.
Exactly. The researchers behind Almanac actually emphasize that a lot in the article.
Yeah, they seem to have a really holistic view of the whole situation.
They do. They talk about the importance of a multifaceted approach,
Okay.
one that takes into account not just the technology itself,
Right.
but also all those human and contextual factors that come into play.
So it's not just about dropping technology into a community and expecting it to solve all their problems.
No, not at all. Successful implementation requires careful planning, ongoing training and support for healthcare workers, reliable access to the technology,
Right.
and probably the most important thing, a genuine partnership with the community.
That makes sense. Making sure that they feel ownership over the solution.
Exactly. Understanding their needs, addressing their concerns, ensuring they feel empowered to use the technology effectively.
It's interesting. The article highlighted how important community engagement was throughout the entire process.
From the very beginning,
Yeah, from the initial design and development of Almanac.
all the way to the long-term evaluation and improvement of the system.
That's impressive.
Yeah,
It sounds like they really put a lot of thought into making sure this would be sustainable.
they did. And that brings us back to the issue of funding, right? These types of interventions can be expensive.
Yeah, and you need a plan for long-term financial support.
Absolutely. But it's about more than just money. It's about building local capacity and ownership.
Giving the community the tools to sustain it themselves.
Exactly. The goal is to create a system that can thrive even without constant external support.
That's the true measure of success.
I think so.
It's a good reminder that innovation doesn't happen in isolation. It requires collaboration, partnerships, and a shared vision for a healthier future.
Almanac seems to embody that spirit, wouldn't you say?
Definitely. It gives us a glimpse into a future where technology can play a transformative role in improving healthcare for all.
That's the ultimate goal, right? To create a world where everyone has access to quality healthcare, no matter who they are or where they live.
It's inspiring to think about. As we wrap up this deep dive, though, I keep coming back to the ethical considerations. We've talked a lot about the positive impacts of Almanac,
Right.
but are there any potential downsides or unintended consequences, things we should be aware of?
That's a really important question. And I think with any new technology, especially one that involves healthcare data, privacy and security are paramount. But the researchers behind Almanac today seem to be very aware of those concerns.
Okay.
They built in a lot of safeguards to protect patient data and ensure confidentiality.
That's reassuring.
Hmm.
But even with the best intentions, sometimes technology can be used in ways that weren't intended. Or it can even exacerbate existing
It's
inequality.
true. That's why ongoing monitoring and evaluation are so critical. You can't just implement a system and walk away. You need to track its impact, identify any unintended consequences, and be willing to adapt and improve as needed.
It's a continuous process,
It is.
not a one-time fix. So as we finish up here, what are some of the key takeaways for our listeners, things they should keep in mind as they reflect on this research?
Well, first and foremost, I think we have to remember that technology is a tool.
Right, not a solution in itself.
Exactly. It can amplify our efforts,
Yeah,
but it can't replace that human element of healthcare. Compassion, empathy, cultural understanding, those are always going to be
I
essential.
couldn't agree more.
Yeah.
What else?
Don't underestimate the importance of community engagement and ownership. When people feel invested in a solution, they're more likely to embrace it.
Make it their own.
Exactly.
Yeah.
And finally, I would say never stop questioning. Technology is constantly evolving. We need to be critical thinkers, always asking ourselves how we can use it responsibly and ethically to create a better world.
Those are some wise words.
Yeah,
Well, this has been a fascinating deep dive.
I agree.
I've learned a lot.
Me too.
Thank you so much for joining me and sharing your expertise.
It's been a pleasure.
And to all of our listeners out there, we hope this deep dive has given you some new insights into the power of technology to transform healthcare and the importance of approaching innovation with a critical and compassionate lens.
Well said.
Until next time, stay curious.